Sorry about that. Thank you so much again for joining us tonight on a Sunday evening on April 12th. And I'd like to thank our supporters, the Lupus Foundation of America, Georgia Chapter, Terry Iman, the Georgia Council for Lupus Education Awareness, and the Goal Research Cohort at Emory University. And I also want to thank everybody for their thoughts and well wishes and prayers for my son, who's feeling much better now. I mentioned last week about how there was a scare of possibly him having COVID. And we still don't know, actually, because the testing isn't widely available and he didn't technically qualify. But anyway, he's getting better and the rest of us are healthy, and thank you for that. Also have great news regarding the retired rheumatologist who was in the intensive care unit on a ventilator for COVID. He is out of the ICU and off the ventilator now and is doing much, much better. So good news all around. And so on this Easter, I think there's a lot of words of hope going today, and I hope this finds you in a similar position. But okay, Plaquenil is often where we start, and just to remind you that the way I see this issue with Plaquenil, especially with regards to supply and the difficulty in getting it, is that as a whole, we need to focus on two main groups that we need to prioritize in terms of maintaining and preserving the supply that we have in hand. One is, even though there's not proven efficacy, and I have to be very clear about that again, that Plaquenil, there's no new news, no dramatic new news anyway, in terms of the studies that are ongoing. So we still await some broader results or stronger results. But in any case, I mean, these are extraordinary times and people require compassionate care when we don't have anything solid in hand. So we continue to use Plaquenil in people who are in the hospital for COVID-19, even though it's not proven to be effective yet. So these are the hospital folks. Now, the other main group that we want to make sure that if we only have a limited supply, that we maintain Plaquenil for those that have been benefiting for that in conditions that are already FDA approved, and that is lupus and rheumatoid arthritis for the most part. These are people that have been taking it before the COVID pandemic and who are benefiting from it. And so these are people that are predominantly outside of the hospital or outpatient. And so these are the two main groups that we want to make sure that we keep the access to Plaquenil adequate. And then everybody else who wants it after that should get it, but these are the main two. Now, the hospital numbers are much smaller than the people that are getting it outside of the hospital. And so this is a point that I wanted to make in terms of a lot of what's going on in the news. And I know some of you are still having problems finding pharmacies that are carrying it. They're running out from time to time. You're still getting maybe just a short supply at a time, 2 weeks or so. And, you know, what does this mean? You might be hearing about all these things happening in terms of increasing supply. Well, the government, the Health and Human Services is the main branch of the government that deals with medicines and healthcare. You might have heard that they received a huge shipment of Plaquenil into their national stockpile. And here it talks about how there were 30 million doses of Plaquenil that were donated by Sandoz, a pharmaceutical company. Now, the national stockpile is used by the government to keep supplies that are essential for national needs. And right now, they're identifying the use for these stockpiles in hospitals and in clinical trials. So as I just mentioned, you know, at any given time, there are not that many people in the hospital taking Plaquenil compared to the people that are outside of the hospital getting refills of prescriptions of it when they were already benefiting from it for the rheumatoid arthritis and lupus. And at Grady, where I practice, just to give you an idea, we're talking in a given month, several hundred tablets of, actually thousands of tablets of Plaquenil that are given by the Grady pharmacies in a given month compared to less than 100 tablets in a given month in the hospital. So even though there's a ton of these tablets that are going to the strategic national stockpile, it's not really clear to me how that is going to translate into the people, the majority of people that are getting it as an outpatient. I have not heard about how the government plans to make this more available to those outside of the hospital and for people with lupus that are having trouble getting it. And it may be that they just maintain it in their stockpile until we figure out exactly how better to use it, if it truly works, and getting a better idea of the numbers in the hospital and outside of the hospital who really need it first. And similarly, there was announcement in the news about how Georgia received one of the earliest states to receive a donation from another pharmaceutical company of 200,000 doses of hydroxychloroquine. And these were donated to the Georgia Department of Public Health. And I imagine that it would be a similar approach that the DPH would focus on the people who need it most in terms of those who are hospitalized. But again, I don't think the shortages in the hospital are as dramatic. And certainly the people who need it the most, the larger numbers, are in the outpatient arena. So again, I don't know of any new news as to how these extra tablets are going to get out into the hands of the people in the general public with lupus and rheumatoid arthritis who've been benefiting. So if you know of any new news, please send it to info at the email address that I'm going to show you at the end, to the Lupus Foundation Georgia chapter, or contact me directly. I'd love to hear more, but I'm going to try to find out more as to how these extra tablets are going to get into the hands of our patients. So some questions that you've sent in. Are lupus patients less susceptible to get COVID-19 because they take Plaquenil? Do you know how many patients have or had COVID-19? And also, Dr. Oz and President Trump have said that people that have lupus aren't getting the coronavirus. I'm sure they're referring to the people with lupus on Plaquenil, but I'm wondering, is this true? Yeah, so Trump has said a lot of things, and he suggested this past week with very confusing and strong statements, actually, about how hydroxychloroquine, from his understanding, may protect people with lupus. And he pointed to those with, from COVID, and he pointed to those with lupus as being an example. You know, here in this piece and from CNN, he says, I think people should take hydroxychloroquine. In fact, I might do it anyway. I might take it. And he said that there's a rumor out there, and mentioned some studies, but he wasn't very specific about it, how hydroxychloroquine was protecting people with lupus, and people with lupus were not getting COVID. And then Dr. Oz, I don't know if he had it on his show, but from what I saw on the internet, at least there was this one piece here. It's a video with a rheumatologist who I know pretty well, actually. He's a well-known lupus physician out in California, Dan Wallace. And it's a very short clip, actually. And I'm pretty sure it's misleading. I'm going to have to talk to Dr. Wallace when I see him next time. But, you know, Dr. Oz kind of asked a question: how many people with lupus in your practice have had COVID? And Dr. Wallace mentioned that he has several hundred people, and he hasn't heard of anybody yet in his lupus practice with COVID. In the hospital where he practices, Cedars-Sinai in LA in California, only had one person with lupus hospitalized with COVID to his knowledge. So, I mean, those two things often, definitely give me an impression that there's something out there with regards to people with lupus being protected from COVID. So what do we know about that? Well, we know very little, and what I can tell you for sure is that there are people with lupus that develop COVID. And I mentioned last week there was a patient of mine who was hospitalized and was just being discharged um, from a hospital with COVID. And thankfully, she's doing much better. And I've heard of many other people in other states with lupus that have been hospitalized. This isn't solid scientific data. It's ongoing, just like everything else with COVID. But I mentioned in the weeks past, there is a worldwide effort through this global rheumatology alliance where they're putting together a worldwide registry. And it's not just for people with lupus or patients with lupus, but all those with rheumatologic conditions, including rheumatoid arthritis, vasculitis, and other conditions. But it's being put together for physicians as well as patients to submit information. It's all de-identified. And again, this is extremely early. This is as of just a few days ago. What have they had reported from physicians? So they've had 234 patients that physicians reported that had COVID positivity from throughout the world. And you can see here the breakdown is about a third had rheumatoid arthritis, 20% had lupus. So there are people with lupus, and then you can see some other conditions. Interestingly, 3/4 are female and 1/4 are male. And it just could be that some conditions like lupus are so much more in women compared to men. But we have heard that COVID seems to strike men more than women. And in terms of race, ethnicity, um, about 50% are white. And I think this is a lot to do with the fact that this is global and there are a lot of European countries with less minority populations that are reporting to this. Just like a lot of multinational studies with lupus, the minority segment is much less represented. And by the way, many of you are hearing about the disproportionate impact in minority populations of COVID. And given that lupus also disproportionately afflicts minority populations, again, it would be interesting to know a little bit more about that. And we don't know any yet that's very solid. And so that's another reason to do more research like this. You will see here that in terms of Plaquenil, it's kind of small, I know on your screens, but here's the website over here if you want to go into it later. You'll see that 29% were on hydroxychloroquine. Again, not everybody in this group had lupus. A third of the people that had rheumatoid arthritis, there's going to be some that were taking hydroxychloroquine in that group. But again, this tells you that if hydroxychloroquine were that strong of a protector, it may not be as high of a percentage here. But this is extremely preliminary. I'm not saying for sure that this is saying that Plaquenil is not protective. I'm saying that we don't know yet. We just know that there are people with lupus that get COVID. There are people with lupus on Plaquenil that get COVID. And it could still mean that Plaquenil is beneficial, or it could mean that it's not. So we still need more data. And again, this is just barely a few weeks into the pandemic. And we've already started getting all this amazing information. We're just not close to being more definitive. I will tell you that we're still not ready to disclose anything yet in terms of an effort here in Georgia, but we are very, very interested in how COVID affects people with lupus so that we can inform our community better. And again, we're extremely interested as to how it may or may not disproportionately impact the minority community. So it's very important for us in Georgia to understand the impact. And we're going to go through GOAL and we're going to open it out to a lot of people to report. But it may just take us another week or two at least to kind of put that together. Please be on the lookout. So, I think all of this in terms of the information that's coming out, bottom line is we still don't know. But I think the press conferences that indicate that hydroxychloroquine or Plaquenil may be protective, the rumors that are going around that people with lupus are being spared COVID are just fueling the fire for people to rush out and try to get hydroxychloroquine. So I'm not even talking, obviously, about the people with COVID in the hospital. I'm not talking about the people with rheumatoid arthritis and lupus that were already benefiting, that are already trying to maintain their refills. But on top of that, what's putting pressure on those two groups are the many people that were not taking Plaquenil regularly before COVID, that are hearing these rumors, that are going out and trying to get refills. They're the doctors themselves, and this was an article in the New York Times, who are hoarding and writing prescriptions for themselves and their family members. I mean, it's just really out of hand, and that's what's putting really the pressure on the supply. And we need to inform people that these rumors have an impact. They affect lives, in that they are keeping the supply of Plaquenil out of the hands of people who are benefiting from it. And this is an opinion piece out of the New York Times from a patient, someone who's living with lupus, who's having trouble getting their Plaquenil, and just telling her story about how all of this is affecting her life, as you all very well know. Next questions. With the COVID-19 pandemic dragging on and not being able to be tested, how should lupus patients face the immediate future before and after the mitigation is lifted? What extra precautionary measures should we take than the general public who are healthy? When do you think things will get back to normal? My anxiety is getting worse every day. What special precautions will people with lupus need to take when the country opens up again? Actually, this is good in the sense that we're starting to think about the next step. And even though we're not past the surge, as you're hearing about, it is good that we are starting to look forward, and that's where we need to always look forward. So where do we, as caregivers of people with lupus and those who are living with lupus, what should we look forward to in terms of the new normal? And when can we get back to normal? And this is just a reminder of what I talked about the first week, is the mitigation or the stay-at-home orders are all pointing at trying to flatten the curve. And you've heard this many, many times. And remember, when we stay at home, we really enforce social distancing to this extreme. What we're trying to do is reduce the number of people that get infected from every one individual who's infected. And if you have 2.5 people that are infected from one individual, without social distancing, those 2.5 people translate over 30 days to 406 infected individuals. Not all of them get hospitalized, but a percentage do. So the larger the number that get infected, the larger the total number of people who get hospitalized and get really, really sick. So what we're trying to do is keep the curve, this number of people with COVID positivity, from getting so high that it crosses the number where the healthcare system can't handle and manage them. And you're hearing about the shortage or potential shortage of ventilators in certain areas. So those are the really, really sick people that when they get to the hospital, we need to have a certain amount of resources, both in terms of the number of doctors and the machines to support them, and the medications to support them as well. And knock on wood, early signs are that we're making a difference. We're not out of the woods yet. So this curve is being flattened, and hopefully it'll stay at or near this capacity line where the healthcare system can't handle it anymore. So to answer the questions, we're looking more ahead here when the curve starts flattening out. And by the way, this figure here is a little misleading because it'll never go back to zero. This virus is out in the wild. It's loose. It's like the cold. It's like the other flu that we're used to. It is going to be a part of our world for the foreseeable future. But what we do hope is that over time, there'll be less and less people who get affected by it. One, because there are going to be a lot of people who get it and recover and have a certain amount of immunity. And there's a big question as to how long that immunity is going to last, but that's a part of it. And then really the thing that's going to make a big difference is the vaccine that'll come out. But my point here is that there's not going to be a point after the stay-at-home orders get lifted up where the social distancing will completely go away, because there will be cases out and about. The COVID virus will be around. And, until we have a cure for it, and that is really, the vaccine, or we have treatments that will really protect people from the most severe results of the COVID infection. These are the things that are going to be a part of our new world. And until we know more about the effect of COVID on people with lupus, until we have this research data about whether having lupus or having lupus on Plaquenil may be protective, or is it because you're immunosuppressed with lupus, along with a bunch of other medications that suppress your immune system, does that make you at greater risk for COVID complications? We have to assume at this point, until we have other information, that because of the immune issues in lupus and also the comorbidities, meaning the other medical conditions that often go along with lupus, and that is high blood pressure, heart issues, lung issues. Some people, because of the treatment, will have diabetes, and you're hearing about how these associated medical conditions really increase the chance of poor outcomes and even death in people who develop COVID complications. So again, without any more research information, we have to assume that people with lupus are at much higher risk, and they're in that high risk group. And we have to exercise with even greater caution these things that you're really tired of hearing about. And these are the things that are going to protect us: is washing our hands often, covering up our coughs and sneezes, don't touch your face, clean surfaces often, stay home when you can, and especially when you're sick, and avoid sick people. And the reality is, and it's a very strange thing to think about, is that these masks that we're actually being encouraged by the CDC now to wear in public is going to be a reality. And the masks are there really, as I mentioned, to help protect other people. If you unknowingly have COVID infection when you talk or when you cough or sneeze accidentally, you want to prevent that from going to someone else. But there is a measure of protection for yourself as well too. So obviously, if you have lupus, all of these things, especially wearing the masks in public, will be a part of our lives. Our restrictions will be less, but these things will be a reality, and they will impact many things. It will open up more interactions with the outside world. More doctors will allow visits, physical visits to the clinic. But I think, for the foreseeable future, at least the next year or so, I envision almost everybody coming in with masks, and I expect myself to be wearing a mask at all times in the clinic and the hospital. And again, that's really going to be our new normal. And with everything that's new and different comes a lot of anxiety, and I really appreciate that whoever had sent that question about feeling anxious, because I know that all of us have this going into this new phase, because it's new. And I wish I could give a magic answer, and I'm not going to demean this topic by giving some pat tips, 1, 2, 3, 4, and it should help reduce your anxiety. I think to a certain extent this is expected because again, with anything that's new and you're not really sure what's going to happen. I think part of this is just understanding that this is normal and it's okay. Um, but I know there are people that to which the anxiety is at a much higher level and may not be um, very productive, and it can be a bad thing. And so this is where we really need to come together as a community, keep an eye out for each other, and really look for the people who are suffering from this and really need some help, some professional help. Um, and so, if this is you personally, I just want you to know that um, I'll be praying for you. This is a very early time, though, and I know things may seem extremely unsure and horrible. What I just mentioned about being pushed in your home even more than you were before. I think many of you who lived with lupus prior to the pandemic know this feeling of being separated and almost being kind of isolated in your home away from others, dealing with the known effects of lupus. And then on top of this, you're being pushed away even more. But what I can say is that um, part of this is understanding what you're going through and seeking help. But the other part of it is understanding that this will strengthen many of you, will give you some amazing resolve to look back and equip you even better going forward. And I want you to know that this new world is not going to always be like this. And I mentioned that the big answer is going to be certain treatments and vaccines, and they will come. They will come. The vaccine itself, which is going to be the huge thing, is going to be at least a year away, and they're working at lightning speed. And I hope they shake the world. And I wouldn't be surprised actually if they say in less than a year if something were to be a lot more advanced. But I think we need to prepare ourselves for at least a year or two at the most, hopefully, um, of being in this new normal. But it will not be like this forever, and we can get through this together. I continue to get questions regarding how there's so many symptoms with lupus and not sure whether they have COVID or not on top of it. And this is on the left, all the many things that can happen in lupus, and this is probably a short list. And the right are the typical symptoms of COVID, and you can see that there's going to be overlap between the two. So I can understand the concern, but on top of what I've said in the weeks past, I think with COVID, another way to think about it is, there are two primary concerns. One is, there are many, but I think I would think of it this way: having a COVID infection, first, you want to make sure that you don't have a severe COVID infection where your health is and life is in danger, severely in danger. And really, the main way the COVID virus does that is through the lungs. It's a severe and a unique type of pneumonia where there's uh, significant difficulty in breathing, and it comes on, fairly quickly. So I know many of you do have lung and breathing issues as a part of your lupus, and some of those symptoms may wax and wane um, week to week or day to day even. So some changes you're used to, and you understand your body better than anyone. And if your breathing level changes somewhat within the range of what you're used to, I wouldn't jump to it right away. Still mention it to your doctor, but the the shortness of breath that is life threatening with a COVID infection often tends to be something that comes on fairly rapidly over the course of days. And there are a few other symptoms along with COVID, along with the shortness of breath that occur in COVID. The fever, um, dramatic change in fatigue, but I think the fever is really the main clue. I think especially at this time, if you are having a big change in the cough, a significant increase in your fever, along with a very big change or worsening of your shortness of breath, that is by certainly major red flags for you to go seek medical attention soon rather than later. Now, the other thing though, so one, I mentioned two things of primary concern if you live with lupus and COVID. One is rapidly progressive COVID pneumonia. So, um, very quick worsening of shortness of breath in the setting of fever and a dry cough that's big and different. So the second thing is infecting others. And if you think you're having any new or worsening symptoms that are typical of COVID, for now, you should assume that you may have COVID infection, and you should consider isolating yourself from others and your loved ones the best that you can. Call your doctor, and if COVID is high on the list, they'll direct you to different things to do. Fortunately, most people will eventually heal on their own from COVID infection, but half the battle again is knowing who your enemy is, and so there is more and more testing that is available out now. It's changed even in the last week. And I know CVS has some drive-through and free testing sites around Atlanta. If you go on cvs.com and go under their Minute Clinic tab, they'll ask you some questions and you have to meet some criteria. But if you just mention worsening shortness of breath or things like that, it should get you through. And your private physician may have access to commercial labs, although they're taking a longer time. And so we're getting to the point where you won't have to kind of guess like we've been doing the past couple of weeks. You'll be able to get our test result sooner and faster. And what's really going to change things is when we have these rapid tests that are available in doctors' offices or even in these urgent care centers. These technologies are being approved now by the FDA. They're just not widely available yet, but hopefully it'll get to the point where you can just call your primary care physician, for instance, or just walk in even, be able to prick a finger and within a few minutes know right then and there. And then that'll eventually allow people to know whether they're a carrier, they've been exposed, or a lot of other things, and will help us in this new normal again. And you're hearing about different ways that the future can look in the next year or two, where maybe some people carry cards around saying that they've already been infected and they're immune. I don't know. It's going to be a lot of different scenarios. So we'll just have to keep an eye out. But the good news is that testing is starting to become more and more available. Okay, I'm nearing the end. I just wanted to thank the Lupus Foundation of America, Georgia chapter, and Terry Emond again. They have a COVID resource page on their website that you can click on to, and keep sending your questions to info@lfaga.org. We'll keep doing this every week as long as you'll have me. And I wanted to give a chance for Terry to speak and close this off. I'm going to unmute you here. Okay. I think you can talk, Terry.
Okay, can you hear me?
Yeah.
Okay. Sam, I want to thank you, Dr. Lim, for doing this every Sunday night. We've gotten a lot of great feedback on this, and it's a great way. I'm hearing that when people put their head down on the pillow on Sunday night, they feel reassured by a lot of great information. So I really appreciate that. I want to say to each and every one of you, thank you, because by coming on these calls, you're taking a proactive step. You're saying, I'm going to learn more about this. You're not going to let the anxiety just swirl around in the gray matter of your brain. You're going to find some answers. And I agree with Sam on giving some just, that we can't just give, bullet points on how you cope with this. But a couple of things that you can do is recognize your anxiety, recognize that you're having trouble, recognize that this is getting to you a little bit. You know, it's getting to everybody. And then try to find some ways to work through that. And that is recognize, is this more anxiety than usual? You know, do I need to get help? Do I need to just talk to somebody? Reach out to somebody. Reach out to other people that you think sound anxious when you hear them on a social media post. Stay connection. I think the connection is what's going to make a huge difference for many people. It helps you help others, and that always helps with anxiety around circumstances like this. But the other big thing I want to give a call out for our support groups. All of our support groups have gone online, and it's just a great opportunity to just check in with each other. We've got Decatur support group on Wednesday night. We've got the young adults on Decatur's on Tuesday night, young adults on Wednesday night. We're going to have a week from Tuesday, we will have our online support group that meets online anyway. But these are just great opportunities to connect with each other and check in and share coping strategies. You guys know best what you're going through. I want to close it out though by saying, y'all have been through a lot already just by having lupus. You've had frustrating diagnosis a lot of times. It takes a while to figure out your medications. You've had to learn different ways to live, whether it is through job modification or going on disability. And you've done it. You've done it. You're still standing. You're still here. And the greatest predictor of the future is the past. So you've done this before, and you're going to do it again, and you don't have to do it alone. We're all here for you. So Dr. Lim, thank you again. This is just amazing. And it's a great resource for our patients and the lupus community.
Yeah, it's a pleasure to be part of this community. Thank you all. And as I wrote in the chat room, that we may have opportunities in the future for live questions. I'm sorry I can't get to the questions on the chat board, but please do email them. And if you have ideas about how to change this format that will benefit you better in the future, please let us know. And this is for you. And it's an honor and privilege to be a part of this effort and to walk with you. And we will get through this. And I thought we needed a little brevity throughout all of this, but I hope you guys have a wonderful week. I'll see many of you next Sunday. And please be safe during these storms. And I hope you had a wonderful Easter and Sunday. Take care.
Thank you.
Thank you, Terry.